I'm delighted to be here. I think, yeah, the recording has started. Right?
Yes, apologies for that, and I should have said that that we're going to record this as well, so I've just started that.
That's great. Thank you, Brendan. So I'm delighted to be here. I'm going to start to kick off the session, and my colleague Amanda Crean, who you also see on screen, will take up the second part, which is the case study. So welcome, everybody. So I suppose in terms of introductions then, oh dear, why is it not going on? There we are. So my name is Siobhan Duggan, Director of Healthcare and Innovation with GS1 Ireland, and my colleague Amanda Crean, Healthcare Manager. So to kick off, I want to check in with you all. I think Amanda is going to do Brendan is going to do the poll, and is that coming up? If there's an issue with the poll, we can just throw it into chat, so we can capture it afterwards. Okay, so
I just need a second to set that up. Just give me 1 second.
We can come back to it in a moment as well, Brendan.
Perfect. Yeah.
Are you happy to do it, or we can
proceed? I'll set it up afterwards in the next minute or so.
Grand. Okay. Perfect. That's no problem. In any case, I think if you're here, you might know a little bit, and hopefully you'll know more by the end of it. So the agenda today is, I suppose, an introduction to GS1 to give the context of why we're here, the role we play in health, and why barcodes, why supply chain. I think you'll hear a lot of interesting areas. Some you may have heard of, some you may not. Traceability standard. It's not just in Ireland. This is worldwide, and I appreciate the audience is quite varied this morning. But I suppose the focus is on small companies, startups that need to get up and running fast. So you want to get it right early, and that's I suppose the message this morning. We'll go into the case study around the tracking of the COVID vaccine, some of our own learnings as well, because I suppose it's software that didn't exist this time last year that we ended up developing, really, I suppose, in collaboration with HSE. So some great learnings from that, and summary questions and answers. So I will stop at a couple of points to take questions, but if you do have a question, do type it into the chat so to make sure we can take it at some point, either during or at the end, and we will have a session at the end as well. So we're keeping Brendan on his toes this morning. We have a second poll, so we could just jump to this poll if you're ready, Brendan, or we can continue the presentation.
We could do the reactions either, Siobhan. I've used that in previous one. If people would like to use the thumbs up or the yes or no in the reactions as well.
Remind people where the reactions are. So it's
in the bottom of the screen in your setting, you should be able to see a little smiley face with a plus, and it says reactions underneath.
Super. Okay, so we'll just take a minute for that. So do you have any experience in barcoding? And I suppose it links to the previous question as well. I mean, are you familiar with GS1? Are we getting any reactions?
I can't see any yet, but I'll test it there. Yeah, no, I see a few there.
Great. Okay, so a few yes and no's. Great.
Yeah.
Thank you very much. So we'll go to the next. So introduction to GS1 and its role in healthcare, and I suppose our role in healthcare. This is always a great table quiz question. What was the first barcode scanned? And I suppose it feels like yesterday, but actually it's already, and in fact we're going beyond 45 years at this stage. I think we're celebrating 50 years next year. There's always a couple of different dates that I suppose determine the very first origins of barcode scanning. But I suppose the real milestone is the first juicy fruit that was scanned in a retail store, and that really, I suppose, triggered the development of barcoding, barcodes being added to packaging across retail, and making, I suppose, the efficiency in retail. I suppose all of that has really revolutionized and continues to revolutionize retail. But also those learnings now have been taken into healthcare, and GS1 continues to support many other industry sectors as well. So its first scan it's nearly 50 years ago, and I suppose the organization has evolved hugely since then. GS1 is a global organization, and I suppose we are the standards organization for barcoding and traceability. We would work very closely with ISO SEN as well, feeding into the standards development processes there. We work with members around the world, and I suppose the business model is essentially, if you need a barcode, you take a license, I suppose, the ability to use globally unique identifiers on an annual recurring basis, and I suppose so that you can identify products so that they can be sold around the world. And I suppose industry has, I suppose, chosen to work with GS1 because in this area, while you might have retail and suppliers competing very fiercely, when it comes to supply chain, they all agree this is where we collaborate, because this is where the efficiencies can be achieved. And so that's a very quick overview of GS1 as an organization. And as a result, because of the relationship we have with so many different industry players, we are a not-for-profit, which means we're neutral and we can support the sector and bring communities together. I mentioned industries, so I mean today the focus is health. A lot of our origins are from retail, but actually health now is really challenging traceability standards, the requirements from a regulatory perspective, and I think we're going to see a lot of the learnings now from health will probably be taken back into retail as well. As you can imagine, transport and logistics, food service, technical industries, and clothing, apparel. The construction industry is huge as well, tracking assets, even just managing the whole construction projects. There's lots happening there. So lots of different industry sectors, but obviously today is health. I'm not going to go into all the details in this slide, but I suppose if there's a one-pager on what GS1 does, this is a nice tool that we've prepared to help people get an overview. So I suppose we talk about identification, and it started off with products, but as you can imagine in health, you need to really identify and track everything. So people, locations, assets, documents, logistic, pallets, boxes, that the boxes of vaccine have an SSCC. So there's, and as you can see, lots of acronyms. So we try to stay away from acronyms when we talk, but obviously they sit behind to support the work being done. The barcoding piece, we all are familiar with barcodes, but what is not always completely understood is the importance of structuring the data in the barcode, so that when you scan a barcode, you don't just get a number, like what is it? Is it a telephone number? Is it a batch? Is it a patient? So the piece of information before the number or before the piece of information tell the scanner, tell the system, I am a vaccine, or I am, this is my batch, this is my expiry. So that's a really, really important point, and that's where I suppose the role that we play in terms of the standards piece. And then the traceability of, the sharing of that information, the track and trace, for starting with the master data. So what is this product? Is it a person? Is it a place? And then also all of the tracking from start to finish, all those transactions, and the purchase to pay process as well. There's an element there. We are conscious that we talk about standards in health, and I mean GS1 is one standard of many in health. There's many, I suppose, important standards, particularly in the clinical area. And this organisation here, the Joint Initiative Council, I suppose is a collection of the key standards organisations in health. And then many of you might be familiar with HL7, which is clinical messaging. The ISO SEN would be well known as well, and then getting into further the health area, IHE, DICOM. So GS1 will collaborate with all these organisations, because each standards organisation has a role to play, and often there'd be an overlap where the standards complement each other. So then, why barcodes and supply chain? So we're all fresh from pandemic, and I suppose at the start of the pandemic there was a huge rush on getting personal protective equipment. Many of us didn't even know what PPE meant at the start, but we all learned very quickly. And there was a huge requirement around the traceability of knowing the source of the equipment, because some arrived and it just wasn't the right level or standard for the healthcare providers. And also tracking, knowing what was even in stock, became a real challenge for health authorities. So that's where the GS1 standard, the barcoding traceability can really play a role. And we'll talk later about GS1's role in Ireland as part of this supply chain challenge. Keeping it simple, because today is really about giving a flavour of what GS1 does in the different areas, and also how, I suppose, what you need to know as an organisation operating in health. And this is what we talk about, the vision for patient safety. And I spoke earlier about the importance of structuring the data in the barcode so that when somebody scans it, it knows what it's scanning. And as you can imagine, we're moving, particularly in healthcare providers, from a world of paper to the world of electronic. So it's really important. We all know the computer does black and white, it doesn't do grey. So you need to really, the computer needs to know what it's scanning, what's happening, and it needs to be very precise and have structured data. So I'm a location, I'm an asset, I'm a product, I'm a doctor, I'm an instrument. All of these data points build up to a really, really rich data set and can be captured quite easily. And you're not relying on the human error to rekey data or to handwrite it somewhere. So when barcode traceability is done correctly, the data piece is really the big win. And that's what we talk about, the accurate data from the point of care. And Amanda will talk later about the work we've done on track facts. And one of the bits, I suppose, it was really, really took people's attention was the fact that the data quality, number one, but also the information, the reporting bit afterwards around what stock is where, vaccine usage, all of that really rich data that allowed clinical decisions to be made fast. And that's really what we're all working towards. So, sorry, so we have another poll. And again, maybe if you have a moment, just put it through. It's probably simplest just to put a word into chat if you can.
Yeah.
And so what do you think standards-based traceability, why do you think standards-based traceability is important? I mean, with the knowledge you have, is it based on interoperability for patient safety, inventory management, time back to patient care, regulatory compliance, or all of the above? So if you have a moment, you can throw that into chat and we can capture that. But just to get you thinking about this. So I suppose this is a slide we use. So what is driving the need for standardisation in Irish? And we say Irish healthcare, but obviously this is across the world. It's not just in Ireland. Every country is at maybe a different stage, but the challenges are similar. And one of the big drivers is regulatory, which we'll speak about in a moment, and cross-border trade. Oh, here we have a poll. Great. Thank you, Brendan. Great. We made that too easy. We should have thrown in a few others. Thanks very much. Great. Yeah, so the poll results, all of the above. So I think you're all paying attention. Thank you. So cross-border trade, obviously with Brexit, there's a challenge around even just identification, and some products needing to be repackaged. So again, that's where the barcoding bit comes in. Scan for safety, you may have heard of it. This is an initiative. I suppose the term was coined by the UK hospitals, but really it's happening now around the world where healthcare providers are moving away from paper, introducing scanning at the point of care. And it sounds simple, but it's actually quite challenging to do if it's not something you've been doing. There's sometimes staff, they need to be trained. You know, there's sometimes a fear of the technology, but actually now the software, the hardware that's out there is making it much easier and intuitive for staff to do. So from Scan for Safety, this is a really successful project that we're seeing now hospitals in Ireland rolling out. I suppose well, St James's were the first hospital to do it in Ireland, but actually now Tala Hospital are really engaging with all of their theatres to scan at the point of care. And you know, it requires work around getting the data right for the products, and also the industry need to have barcodes in the products. And I suppose from a regulatory perspective, that's happening. So the timing is right now, and we're going to see, I think, a lot more in this area. So from a you know, if you're a product or a service manufacturer, a service provider, or a product manufacturer, it is important to understand that traceability is coming and to be prepared for it. Lots of operational efficiencies, you know, going from paper to electronic, time back to patient care, and obviously patient safety is huge because you know what happened, you can stand over what you did, and also in the event of recall, it's a much more efficient process. Recall before was and still is in some cases very paper based, takes a lot of time. only yesterday I had a conversation with somebody where that kind of recall is happening at the weekend, because you know, people are just too busy during the week. So it's really important, I suppose, we get this bit right. The technology is there, and I think we've taken this phrase from our colleagues in Australia: barcodes can turn everything into data. I think that's a really nice way of looking at it. So would you like to share the results, Paul? I think the verdict is unanimous. I just clicked share there. Yes, I think, can you see it there, Amanda?
Yep.
Yeah, you can. Great. Okay, super. So thank you, everyone. We'll have another poll coming up, so pay attention. So the regulatory compliance, I've touched on this. So there are two, I suppose there are two major regulations, and both actually have taken effect. From a medical device perspective, it's a starting date, and it will take time to phase it all in. But certainly, the medical device, the UDI piece, the unique device identification piece, has already come in the FDA, under the FDA. So a lot of manufacturers are already compliant in order to be able to sell products in the US. And obviously in Europe, that's now evolving. It does depend on class of device, as you can imagine. Class 3 critical device implant, you know, is going to have more traceability than gloves or something that's more of a consumable. And again, the major regulators have said this must be an internationally recognized organization. In nearly all of the cases, industry have chosen to work with GS1. There are one or two exceptions, but it's more, I suppose, localized. And I think any of those localized, I mean, majority of are now working with GS1 or have plans to work with GS1 to do that identification piece. And sometimes it's just about putting the GEAT and the product barcode on the product. Sometimes there's more information required around batch, expiry date, serial number. For the medicines then, and that's, I suppose, a more, it's cleaner in the sense that all prescription medicines must have a 2D barcode with 4 data elements. So product, batch, expiry, serial number. In the case of the medical device regulation, for any products that are being sold into the FDA or into the US or into Europe and other states as well, the master data, so the product data relating to the product and the family, must be uploaded to the regulatory databases. That doesn't happen for medicines, but it is much more of a transactional repository where every single time a box comes off a line, the information relating to that box must be uploaded to the European repository. And then at the point of dispense, that box is scanned to check, is this safe? You know, has this been checked out before? So it's always the first checkout of that medicine is deemed to be correct. And this is, I suppose, the effort here is to try and avoid counterfeiting, so that now that products are being serialized, so that means every single box is unique, and it's much harder for counterfeiters to try and get any scale because everything is serialized.
And Siobhan, just before you move on from that slide, just apologies to everyone. I've 2022 as all the years there. Obviously that's this year there, those dates are incorrect. So I can redistribute a corrected slide after the presentation. So
oh, sorry,
apologies for that. That's my fault.
Yeah, that's okay. It was a copy and paste, sorry. I won't go into details, but I mean, you know, when we talk about barcodes, it's not just one. You know, we spoke about there the FMD, the falsified medicines. It's the 2D barcode. For UDI, just the linear barcode could be enough as part of the unique device identification, or you might need more. So basically, when you need more traceability, you're going into the 2D barcode. And there is also, I suppose, a move in some cases towards the RFID tags, not from a regulatory perspective, but more from a use case where hospitals are seeing the benefit, where you know where you don't want to actually have to pick up a scanner and scan every time. Like you've got a storeroom with very valuable products or assets, you might want to have a tag that's, once that asset leaves the room, it's registered that I have left the room. So there's this, depending on the use, the barcode can vary, but they're essentially data carriers with information in them. I've touched on this, but I think it's no harm just to go back to basics again, just to get a bit of an understanding. What is in a barcode? All you see is a square with lots of dots, but it is, as we said, structured data. In this is an example of could be a medical device, could be a vaccine, could be a medicine, but essentially I'm a product. I expire on 15th December 2031. My batch number is and my serial number. So with one beep, you have all of that information. So it's really, really powerful. If you're looking at product packaging, this is what it looks like. So for the example of gloves, it's a standard barcode that you see at the point of sale in supermarkets. And I am a product. This is my 13-digit GTIN. In the case of these are again gloves, they have the linear plus the 2D. Again, the O1 says I am a product. Is there an expiry date? And there might be, yeah, there's an expiry date in that as well in my batch. And then same for this longer barcode, you can see a bit more information in it. So there's lots of variety for manufacturers to choose depending on how much information is required from a regulatory perspective to go into the barcode, or also even customer might look for that as well. I was in Tala yesterday at Tala Hospital, and they're happy that most of the products have a GS1 barcode, but there's a couple of outliers, and they want to have a conversation with those manufacturers to make sure they get the right barcode. So, as a supplier into healthcare providers, it's really important that you understand this and get this right. Otherwise, your customer will come back looking for you to put barcoding on, and that's not a good place to be in. It's better to be ahead of the curve and also compliant with regulation. And I suppose from a product identification, so that's a bit more detail. I won't go into the details now, but we can certainly we cover plenty of this type of information sharing on webinars as well, which gets into the details of exactly how the barcode is constructed. And if you are, let's say, a small manufacturer, need to put barcodes on your products. It is important though to be aware that it's not just a barcode for a product, and have the same barcode for, depending if it's 1, 10 or a box or a pallet. There are different identifiers for each hierarchy, and that's really, really important, because if you're familiar with healthcare particularly, the biggest challenge is always knowing, what am I ordering? Am I ordering one? Is it from a hospital? One is in each, but one for a distributor is probably a box. So it's really, really important to get that right and to know within the system, what is there a conversion, or do you capture the each, or do you capture the box? Because that language can vary between hospitals, healthcare providers, and then the suppliers. So that's a really, really important point if you are looking at this, to get it right at the start and make sure your system's designed to cater for these hierarchies as well. And as mentioned, healthcare is moving to barcode with more traceability in one beep. And we do see instances where you have the GTIN on one line and then you have the batch expiry on the next line. That means a nurse has to scan twice. Ideally, one beep is the preference. So the 2D barcode that has everything inside it is ideal. And then as part of the work the HSE is doing that's ongoing around data for Brexit products, but also data for medical consumables, we're seeing now the requirement for GTIN as part of the data set. So that's really important to be compliant with the customers, and not just in Ireland, but also the NHS has mandated this, and other countries around the world. So you might wonder then, how do I get a GTIN? If from a regulatory perspective, if I need to have a barcode on my products, what do you do? This is all very easily available on our website, and I won't go into the details now, but really you need to, I suppose, register your organization. You get what we call a prefix, which gives you X amount of barcodes to assign to products. We have a tool that helps you assign products, and then we also help with, if you're printing a barcode with your printer, to do that verification. So that's all available on our website. But just in case you're wondering, how do I do, what do I do to get a barcode? And also, if we'll often have particularly smaller suppliers, they've suddenly got listed with Tesco's or Dunn's, and they need a barcode quickly. So we'll always work very quickly with people applying to make sure that they can meet those deadlines. So I've touched on the fact that this isn't something that's just Irish. We are global, and the challenge is global as well. There are, adverse events where a medical device can get left inside a patient if you're not sure exactly what you had starting off in the operation. There's no recalls as well, product recalls, the breast implants, the metal on metal hip recall. And if you speak with hospitals and healthcare providers, they will always admit that it's really, really a challenge to recall these products, because you're diving into, you know, records, paper records. Sometimes they've been moved, sometimes they've been separated. It's really not easy. And I suppose the world and regulation is moving towards the need to identify and the need to have registries for these critical items. And as mentioned as well, full fit medicines around I suppose, you know, ensuring that the right medicine is getting to the patient. And I think this meme on the right, the patient identification, is important as well. You know, sadly, it does happen that patients aren't always identified correctly. So again, a lot of work has been done, but a lot to do. How are we on time now? I think I'm nearly done there. So I've mentioned Scan for Safety. I think the whole initiative in the UK is fantastic, and I think we're seeing more Irish hospitals stepping up as well. But I suppose there's so much evidence now that by having scanning and having it doing it based on standards, it means that you're improving patient safety. It's also really giving staff, you know, time back to focus on their clinical activities. They're not spending loads of time looking for things or spending time reordering, looking for approvals for simple replenishment items. So it really is driving efficiency, but also making it safer. And I've mentioned the Tallaght University Hospital, certainly well worth looking at, and we'll hopefully be able to share more on that later this year. When we get our video published. But great case study, and the team were very active in rolling out to additional theatres. So really that's been really embraced at the hospital, and improving the value in terms of the time savings for the staff involved. Oh, I think there's an issue there with the slide, is there? Whoops. Let me just try. Can I edit that slide? It looks like something happened. No. Okay, I'll leave it. Okay, so sorry, this I think one of the polls got pasted in here.
Yeah, sorry.
But it's okay. But we'll just touch. I mean, I think I'm going to hand over to Amanda now in a moment. But I suppose to give you a flavour of the work, I suppose that GS1 Ireland has particularly done, is around, I suppose, demonstrating you know, best, you know, world-class solutions around track and trace. The one that everybody would be familiar with is the haemophilia track and trace. That's the National Centre in St James's Hospital. And really, before barcodes existed on some of the medicines there and the blood products, St James's were asking their suppliers to put 2D barcodes on the products. In some cases, this didn't happen, so it had to be done by the cold chain distributor in Ireland. And they had software then developed that they were able to give apps to the patients. And this is over 15 years ago. So it's before a lot of people had mobile phones, but the patients received mobile phones, and they were able then to administer their care, and the clinical staff then had real-time data around compliance to product being consumed, and also then supply chain was much more improved, and they regained trust because it was a patient cohort that had lost trust with the system. So that's a fantastic example of standards in action, and really adding value to everybody involved. And I suppose then working through a lot of work with St James's, as mentioned, around even just the purchase to pay, getting the data, getting products set up, getting products, you know, the invoicing happening electronically rather than all of the paper. The National Instrument Track and Trace, where all HSE hospitals now have GS1 asset identifiers on the trays, and in some case some of the single instruments that going through the sterilisation. Again, the data from that is huge, and it really does. It's, you know, time and again proven to help when people need to look back and find out what happened where. A lot of work ongoing around National Asset Registry in Ireland as well, and even the National Patient Identifiers of the IHI, as well as locations. And we even saw that with the vaccine rollout that we were involved in. Every location where vaccination clinics are happening has a GS1 global location number. I've mentioned then Scan for Safety at St James has kicked off, and that now then Tallaght have got involved, and there's other private hospitals getting involved as well. So I think we're going to see a lot more around Scan for Safety in Ireland in the future. And obviously working closely with procurement, and they're doing great work really to, I suppose, improve the data, the product data from suppliers. A lot of work in, I suppose, SAP Ariba as well, but I suppose the data element there is making sure to capture the GTINs, and that's really important as part of the data set to know, you know, what's being consumed and be able to track then later on to the point of care. And then I've mentioned the COVID vaccine, which Amanda will speak to in a moment. So I'll move on. We have another poll. So have you tried to develop software to include barcodes? We can either do it in reactions or
I think it should be coming up. Has it come up there?
Great, okay.
Let's see. It's not come up on the screen yet, no?
I don't see it. Do you see it, Amanda? Oh, there.
I've just launched it there, yeah.
Great, okay, perfect, thanks. Great. Everyone's quick this time.
Yeah, and some interesting results there.
Yeah. I'd say we can close the poll. We close the poll?
Yeah.
Yeah. Yeah, so a nice mix. Great to see we've got some people who've already tried, and hopefully you're learning something today, and those who haven't, you know, and this isn't, you know, obviously you don't all need to go off and start developing software, but regardless, you know, even if you've touched on the requirement for traceability, it's important to understand what you should be specifying, you know, if you are involved in the design of a new process or system, that is important. And we often get requests for information that would be included in tenders, for example, to specify the need for barcode traceability based on standards. So again, do come back to us if you need to have more information on that, or even if you're providing a service and need to understand that better, we're happy to work to talk you through that. We shared the results, did we?
Yes, it was
yeah,
30-70, 30% yes. So
thanks, great. Okay, so I'll just do a short introduction. I'll hand you over to my colleague Amanda Green. So we've mentioned I suppose the vaccine traceability program that we've been involved in. This all kicked off, it was actually this time last year, and where I suppose when we all suddenly started to hear the confirmed reports that the vaccine was coming, we were getting supply, and we were going to try, the HSE were then, I suppose, tasked with vaccinating the population. And as you can imagine, and as you've seen, it has been a huge project to, I suppose, get vaccination out to the full population fast and safely. And I suppose our board and CEO wrote a letter to Paul Reid to offer support, because I suppose we have the experience in terms of traceability and barcoding. So as part of that, we got involved in advising around the barcoding piece and the tracking, as well as the supply chain of the COVID vaccine. And as we got further into the project, it became clear that I suppose they needed more help on the area of the actual tracking of the vaccine, and that's what Amanda will talk about now. So it has been a fantastic project and privilege to be involved in. It has been very intense for all of us, and I suppose today we'll share the story and just a bit of an overview as to what we've done. And I suppose it is, as Amanda will say as well, it's the collaboration. It wasn't a GS1 Ireland project. It was very much GS1 Ireland in collaboration with the HSE, and we worked really closely with all of the key stakeholders. So I'll hand over to you, Amanda.
Perfect, thank you, Siobhan. So I'm just going to start sharing my screen now.
And sound, did you add sound as well?
Sorry, yeah, I need to perfect. So can you see my screen there okay now?
Yeah, we do.
Perfect. So thank you. It's great to be with you all here today. So as Siobhan said, my name is Amanda Green, and I'm the healthcare manager at GS1 Ireland. And I'm excited to share with you an overview of what has been keeping us very busy here at GS1 Ireland for the past 12 months. So just to set the scene in a general sense, first of all, the pandemic really has been a catalyst for change, and we have seen this rapid accelerated development and rollout of new digital solutions in response to the COVID-19 pandemic that could not have been imagined at that pace before. And it's clear that standards, particularly identification and Traceability Standards have a huge part to play, benefiting supply chains as a whole, but more specific to healthcare, enabling safer, more efficient care. So I think, Siobhan, you gave a good overview here of how we got here, the background to developing TrackVax and ScanVax with the HSE. So from the work and the offers of support, the HSE, in collaboration with GS1 Ireland, adopted a GS1 standards-based approach for the identification and tracking of vaccines to the point of vaccination in the centralized vaccination clinics. So this involved some very intensive design phases, which are still ongoing with the HSE project team. And the outcome of this was, as I said, 2 software applications, one called ScanVax and one called TrackVax. So the first stage of the process was the development of ScanVax. So at the start of the program, when the vulnerable and healthcare workers were being vaccinated, batch and expiry information was being keyed into the national system manually. So this was a very time-consuming task, prone to error and not sustainable. And as Siobhan covered in earlier slides, so as a result of the EU's Falsified Medicines Directive, manufacturers of prescription medicines, including vaccines, are required to assign this 2D data matrix barcode on the secondary packaging of the product. And this means that the traceability data can be captured in one scan. So GS1 Ireland, in conjunction with, in collaboration with the HSE, provided the software ScanVax, and this was developed and installed on over 1,000 PCs across the country to allow for the receipt of vaccines to locations. So this is done by scanning the barcode on each of the vaccine boxes, and this information, and so this is when it arrives at the vaccination location from the distributor. And this information is then uploaded to the National Vaccine Administration System. And this means then at the point of vaccination, the vaccinators can easily select the correct batch. So again, this saves a lot of time and a lot of manual work, which would be prone to error by manual typing it in. So then came the real challenge. So the evolving situation with the pandemic meant there was a race to get people vaccinated, but in a timely and safe manner. And as COVID-19 vaccines became available for the wider population, the HSE COVID-19 planning teams worked intensively on the design of these purpose-built centralized vaccination clinics. So as a part of this design phase, it was agreed that a standardized label was required to remove, as you see here on the screen, a non-standardized, time-consuming, prone to error process of handwriting the labels. And given the time constraint, GS1 Ireland was asked to provide software that would be able to print these labels with a barcode added, with the so there'd be the potential of scanning at the point of vaccination. However, as you can imagine, the overall task here was very complex and multidimensional. So questions included, how do we view inventory levels locally at these vaccination centers and also at a national level? How do we manage the cold chain and the dynamic expiry dates? And also it's a complicated process, and there's a need for this standardized approach due to changing staff and general kind of staff shortages. Alongside that as well, it was also critical for the HSE's National Immunization Office that no dose was wasted, and that the batches of the vaccines could be tracked right to the point of vaccination for full accountability and oversight of every dose. So it was identified then that they needed an efficient and effective way of receiving, administering, tracking and reporting vaccinations across more than 40 centralized vaccination clinics, which opened throughout the course of the vaccination program. So this label printing software, which I alluded to a couple of slides ago, ultimately evolved into what we call now TrackVax, which is a full track and trace software which identifies, labels, tracks, and reports on the COVID-19 vaccines in these centralized vaccination clinics. So our team here at GS1 Ireland was in a unique position to advise on the traceability elements of the project, as well as develop this software. And I suppose it's important to note that the software was designed around the medication management process, and the pharmacists were involved in the design of the software from the start. And this was really a key success factor in the project. So then, just to give you a brief overview of how TrackVax works within a vaccination center. So you can see here the navy line, this arrow up the top. It tracks how the vaccine moves through the center from the dispensary area to the vaccination booth, and then at the empty vials return then to be reconciled at the end of the day. And they also record the doses and compare against the National Vaccine Administration System. So if you can imagine this process without TrackVax, it would be very paper heavy, manual, and time consuming task. And this would be very prone to error, particularly in such a high pressure environment. And we now know that at their busiest time of the rollout, there was an average of 8 patients being vaccinated per minute in one of the larger centers. So I might move on here just to the bottom line here again. So this is the flow of the vaccine throughout the center, but the use of TrackVax, they scan the secondary packaging that puts the vaccine into their fridge stock. Then when it's going out to the vaccination booths, they scan the vaccine secondary packaging and print individual vial or syringe labels, which are issued then to the vaccination booths. They then scan the vial label, the barcoded label, that records the yield. And again, this all feeds into the reporting on the vaccine usage, the yields per yield. And what's been very important as well is the stock management piece, being able to see what's available at each center and at a national level. So the benefits have been huge. So I think, as we saw the handwritten label on earlier slides, we see here against that the printed electronically produced label. It's standardized, and the really important thing as well is that it provides the excellent data quality which is required as this data capture is automated. And again, here just to quickly cover some of the reporting. So we see here some of the paper-based tracking. You can see here maybe recording the yields here in a handwritten record, whereas with TrackVax, there is this electronic reporting which feeds up to a national level. So I think this picture really kind of tells the story in itself. But yeah, so overall, the software, this was co-designed with the HSE and the NIO, and GS1 standards have really been an enabler for a safer medication management and more efficient vaccine reconciliation process. If you do want to see some more details, we do have a case study, which is available in our website, and also a video. I can play a short video now. It's about 2 minutes long, or do we have time, Brendan and Siobhan?
I'd say might give a summary via the video, and then we'll take a couple of questions.
Yeah, perfect.
Yeah.
And can everybody hear my sound okay?
History tells us that pandemics can last up to 4 years. The vaccination programme has been instrumental in allowing society in Ireland to reopen after 18 months.
TrackVax has been central really to the way that medication safety has been managed in the centralised vaccination centres. I think the most important thing has been that it's allowed us to have a standardised approach right across the country.
Traceability is critical to any vaccination programme, so we developed our system called TrackVax with GS1 Ireland. We now have accurate information for the clinicians to use on a daily basis, which allows them to manage the stock records with full traceability on that programme.
TrackVax is a national pharmacy system for the management of the COVID vaccines. It has now been introduced into all of the mass vaccination centres around the country, so that we are all using the one system and there's national visibility of the stock and the consumption of the vaccine across the centres. The vaccine was precious. It was worth gold dust if you remember back, and the TrackVax system helped us manage that very valuable commodity to the best of our ability.
It was very important for the NIO to implement TrackVax across the CVC. The dashboard will tell you at any given time how many vials are in stock, how many doses have been dispensed, so you can trace back the vial at any time.
TrackVax stands out to me as really delivering what was needed. So we've had a fantastic vaccination programme delivered in the centres here in Ireland, and TrackVax has helped us monitor how the vaccine's been used all across that programme. The quality of the data that we've been able to mine from TrackVax just changed how we've managed using the vaccine completely.
The use of barcodes is really, really beneficial and can actually save the HSE quite an amount of time and effort, and now it is about developing that through all the different programmes. So there's a huge potential for it.
So just to highlight just on this last part of the video that as I said earlier, this was an external collaboration really led by the HSE and their National Immunisation Office, and it really required a huge team effort. So I think I'll hand over to you now, Siobhan.
Yeah, thank you, Amanda. And I think we're time is nearly up. So if we just go to that last slide, I mean, I think this is kind of, that was the message we've been trying to share through the presentation, is that barcoding is coming, traceability is becoming more of a requirement, and the challenges are around, I suppose, legacy systems, and I suppose the knowledge when it comes to developing software or even specifying systems for processes. And I suppose that's the role that we're playing in trying to advise and guide on that. And also, I suppose the medical device regulation is requiring that the medical devices, the information relating to some of the classes in terms of the traceability piece is captured preferably electronically. So there is a requirement to do more scanning. Traceability is coming. We hope we've shared that sense and that message with you today. And I suppose there's lots of areas where probably more information. I see one or two questions there from Eunice, which are, I suppose, quite specific, and we can maybe get back to on some of those. They're on the kind of more technical side, and that's where the role that we play is really trying to, helping and advising in these kind of specific areas as well. I think that's the last slide, Amanda, is it?
Yeah, so I suppose we had another poll, and just kind of a keep in touch. I don't know if we wanted to hand over to Brendan now, or
I think I just launched that last question, I suppose.
Yeah, we can do that while we're talking.
Amanda, do you have to launch that as well? I'm just
sorry, no.
I have it there. And just, yeah, so it's up there, yeah. And just as you're filling in that, we can take a couple of questions if you're okay to stay a minute or two longer. Thanks very much, Amanda and Siobhan. Look, it's really interesting, and I think the last slide was a great summary of, I suppose, designing in traceability as early as possible. Just I'll start off one question actually, and then I'll just open it up to, maybe we'll take down the slides afterwards and just see if anybody else has a question. I know Eunice had one there, but just in relation to Ireland and traceability, I see Eunice is there from Germany. How is Ireland comparing to other countries in relation to the COVID traceability and traceability in general?
sorry, am I unmuted?
No, you're on. You can.
You can hear me, yeah, great. So yes, so I think it's a very good question actually, and I suppose each country is involved to varying degrees. And we touched on the fact of the PPE and trying to track and support health services around the world. So certainly I know our Australian and New Zealand colleagues were very involved on the PPE side of things, and other countries as well were very involved. When it came specifically, and we didn't actually touch on the test and trace, but there's a fantastic project there led by Deloitte and it's that sample path, and actually I suppose digitizing the tracking of the samples from the test centres right through to the laboratories. So we were involved there on the advising on the barcoding and providing some labels. So I suppose in Ireland we've been fortunate to have been in the position to be involved both on the test and trace, but also and then also on the vaccine traceability. In other countries, it's been I suppose more supporting on the procurement and the efficiencies there, and in some cases around some of the test and trace areas. So I suppose we're probably, I suppose what I'm trying to modestly say is I suppose the vaccine traceability I suppose is unique. I don't think any other country has been as actively involved in that bit.
Okay. I'm going to, if we end the poll, Amanda, I don't know if you want to summarize that, and we might just stop sharing the screen and go back to see each other. If there's, do you have any comment? I think from challenges, it's probably no surprise that it's pretty complex across multiple areas there. And I suppose the good sign is that resistance to change is low, so I think that shows the enthusiasm and probably the acknowledgement that it's a crucial part of healthcare going forward. Anything from Siobhan or Amanda on those results that that you'd like to comment upon before we take a question or two? You can.
Yeah, so sorry, you're sharing them there. So yeah, I would agree. I think they're all part of the challenge. I mean, I suppose the point is what we're talking about here is it's not just an incremental change. We are all conscious. This was the whole e-health. The digital revolution is definitely a huge change and transformational, and it is in the hard to do bucket. So I suppose that's where this was from GS1 Ireland and our colleagues in other countries would work alongside the health authorities, and it's not something you decide to do tomorrow. It takes a long time, and a lot of building relationships and educating, creating awareness with stakeholders. And I suppose that's why we're in a position also to help industry and help hospitals get involved when they decide they want to do more of this. Does that answer your question, Brenda?
It does, yes. And I should say, I think we'll be sending the slides out afterwards. I'll have to double check with Siobhan and Amanda, and the video will be uploaded as well. So there was a lot covered in that. Look, it's just 1 minute past 12. Are you happy to take it? Does anybody, I see Jay has a question there around barcode or RFID, in relation to medical devices. Is there a preference?
Yeah, that's a brilliant question, Jay. I think the purist would say RFID is probably best, because then you have it in and it kind of future proofs. The reality is at the moment industry will follow the regulation, and the regulation is to have a barcode. But definitely when you come to particularly the reusable invasive medical devices, which would be all the theatre sets that would be sterilized and reused, and there's definitely a strong argument there. Obviously technology needs to catch up a little bit, because you've got a challenge around detecting when it's on metal. So there are now, I suppose, tags evolving where that can be done, and I think we're going to see more of that. So definitely, and I think there are some manufacturers using the RFID just even for internal packaging quality checks and everything else. So there, depending on the use, there are definitely opportunities, and we've worked with St James's Hospital to develop the use case there, and that case study was actually documented this year around tracking even just laboratory samples from the theatre to the labs. So that it really does depend on what the use case and if you can justify the investment. And there's an investment, there's an outlay initially for the infrastructure, but then if you're using the RFID, which is a passive tag, it's low cost, and you can get really different types of tags to meet the needs of the healthcare setting, and you can really essentially, but then you're really into the the Internet of Things, where you can just track everything and have a huge amount of data and data points that you can query and start to analyze patients' journey through the hospital, potentially looking at where the delay, the dwell times, and the room being cleaned, or sometimes you get the patient is discharged but they don't know, no one knows, or someone forgets to call cleaning. So, and somebody else is down in the trolley waiting to be admitted. So, you have all of that, those kind of times that you could potentially look at the efficiency and flow. But that's, I think that's coming in the future as well. So, great question. Thank you. Brendan, I just see a question there from Kevin. Hello, Kevin. Are suppliers using Unimed database for updating medical devices? So I think we are seeing the US databases, it's a data repository as well for product data, and I think that's being used. I think Unimed is still, evolving. I think we really have to see it in full use. I think there was a little bit of delay in that even just being made available, but I think as that becomes more mature, I think we will begin to see that as a repository as well for data and a reference point. Amanda, do you want to say something on that?
No. I think you covered everything there.
Great.
And just if Jonas has a couple of questions there just on the leading zero. I suppose maybe through Brendan he can reach out to us separately and we can go through that in more detail. Or I can send the answers to the question to Brendan to forward on. Yep.
And nice. I think there's just one other question there from Luke, and I think this will probably be the final question. You see, do GS1 track incoming medical devices using barcodes? For instance, when receiving new spirometers, is that how I pronounce that? Or is this
yeah. So if I understand the question correctly, it's really and this, let's say for example, take the hospital setting where you'd have the medical physics and bioengineering department would be taking in a lot of new devices and obviously registering the asset in the hospital database, and then that's in use for X number of years. And so we have worked closely with the HSE and the National Medical Device Equipment Registry, and as part of that, there is the facility for the hospital to, I suppose, scan the initial product packaging to capture the information about that device. That's then linked to the asset registry. So that, that is not being done everywhere, but it's definitely has been designed in and is available for those hospitals that are working with the system provided by the HSE.
I think we should probably call it a day now. I'd just like to thank Siobhan and Amanda again. If you're interested in more events like this, you can contact me at the Connected Health and Wellbeing Cluster, chwcluster.ie. You can join the e-zine. We do have a couple of events for some of the companies that are participating today. We have a huddle with 2 other clusters, digital health clusters, on March 15th. One of them is the Northwest Health Tech Cluster in the UK. So really it's about seeing what's happening in the UK, if there's opportunities for collaboration with other companies or other organizations in the UK as well. And I suppose I'll also give you a sneak preview. Myself, the cluster and dConnect will be launching a new pre-accelerator support program for startups in the digital healthcare sector, and that should be launched tomorrow. So I won't give you all the details, but if you keep an eye on it, it's a 6-week program that will be launching. So if there's startups or early stage companies in your circle that you think could benefit, please come back to us. And as I said, we've an open door policy here, so if there's any types of topics or events that you'd like covered, please refer to us. And if this was a really interesting, I think it's something that we're going to hear a lot more about in the coming years. It's amazing to see, I suppose, the interaction between private industry and HSE, and obviously how it affects patients. So I think it was fantastic to see that. So I'll just say thanks again to Siobhan and Amanda, and you will receive a follow-up email with a link to the video and the slides as well. So thanks very much for participating.
And thank you again for the opportunity, Brendan, Carl, and all the team.
No, thank you, everybody. It was
Thank you.
Yes, and apologies for the slight technical difficulties and not having my camera working. It always happens in these things, but we'll. I'm not quite sure what happened in this instance, but excuse that fact and come back for future events. Okay, I see a message there from. So that's perfect. All right, I'll finish it off at this stage, and hopefully we'll see you at future events.
Thank you so much. Bye bye.
Thank you.
Thanks
Bye bye.
everyone. Thank you.
Bye everybody.
Bye bye.